Ever been caught in the conundrum of whether a sneeze or a cough is a result of a bacterial or a viral infection? Don't fret, it's a common puzzle many face. Today we're diving into the fascinating world of microbes to unravel the differences between viral and bacterial infections. Hello everyone, parents, my name is Dr. Sihar and I am one of the specialist doctors. Today in this video I would try to clear up the confusion between viral and bacterial infections. This is a very important topic to be aware, and many of the parents request to have antibiotics in viral infections. So let's expose the key differences. But before going further, please subscribe my page and don't forget to hit the icon bell button for more new videos. To the untrained eye, symptoms of viral and bacterial infections might seem strikingly similar. They both can cause fever, cough, sore throat, fatigue, and more. However, the devil is in the details. Viral infections such as the common cold or flu often come with a slew of symptoms all at once. Bacterial infections, on the other hand, tend to focus their wrath on one area at a time, like your throat, sinuses, or lungs. As for the culprits behind these infections, viruses are tiny, much smaller than bacteria. They're not exactly alive, but rather a code of genetic material wrapped in a protein coat. What is their mission is to invade your cells and use them to reproduce. And bacteria, in contrast, are single-celled organisms that can live almost anywhere, in the soil, in the water, and yes, on your skin or in your body. Some are good, aiding in digestion, while others are the mischief makers, causing infections. What are the difference in symptoms to know? And common viral infections such as an upper respiratory infection can typically be detected by a runny nose, cough, low-grade fever, sore throat, and difficulty sleeping. No antibiotics or antiviral medications can hasten recovery from the cold. Of note, when compared to adults, upper respiratory infections in children may last longer, up to 14 days, and occur more frequently, average 6 to 8 per year. Bacterial infections may be the result of secondary infection, meaning that the virus initiated the process but a bacteria followed. When the symptoms persist longer than the expected 10-14 days, a virus tends to last. Fever is higher than one might typically expect from a virus. Fever gets worse a few days into the illness. Rather than improving in that case, seek medical advice from your GP immediately. When it comes to treatment, the distinction between viral and bacterial infections becomes critical. Antibiotics, powerful tools in the medical world, only work on bacterial infections, and they target the growth and division of bacteria, helping to nip the infection in the bud. But with viruses, it's a different story. Please bear in your mind, antibiotics won't work on viral infections. Viruses are in your own cells, making them harder to target. Your own body immunity is enough to fight against viruses. I am talking about common cold viruses. These infections require rest, hydration, and patience. In some cases, if the immunity is low in some children due to certain medications for illness, then antiviral drugs can help. A parent of these children seek medical help immediately. Now, let's recap the key differences between viral and bacterial infections. Viral infections are caused by tiny, not quite alive invaders that hijack your cells to reproduce and often come with a variety of symptoms all at once. Bacterial infections are caused by single-celled organisms, can be targeted with antibiotics, and often focus on one area of the body at a time. So next time you or a loved one is feeling under the weather, remember these distinctions. While it's always important to consult a healthcare professional if symptoms persist, understanding the differences between viral and bacterial infections can help demystify what's going on in the body. Knowledge, after all, is the first step to recovery. And with that, we close today's journey into the microscopic world. Stay curious, stay informed, and most importantly, stay healthy. Until next time, keep exploring the fascinating world around you. Thanks for watching.